Okay. Now we've only been here 40 minutes. I don't usually give you a break this early. So what do you want to do? We're going to switch gears. We're going to go to the lab material. First one that says anything gets it.
I think we should just go ahead.
Okay. I knew that. Oh yeah, we got the thumbs up there. Okay. That's week 1. Okay, you're still seeing the screen now, all right? My screen?
Yeah.
Okay, then the condensed muscle list, I asked you if at all possible to print it out. This has been my week for bad technology. My printer gave out, and it says I need to do this, that, and take it to the service center. The printer isn't worth that much. Jeez. Okay, so I've got a new printer at Target waiting for me to pick it up, but I'll get over there. Fortunately, a printer is one of the things when you're teaching online that you don't need. I mean, I don't need it anyway. Everything's electronic. Okay, so the condensed muscle list. Okay, this is the one that you have. It's got, as we recall, 69 items. I'll figure out what the other 2 are. You need to consider that anything on this list and the previous list is important. But this one is nice to have because it has the abbreviated origins and insertions. Maybe some of you are taking it upon yourself to learn the entire origin and insertion. Great, because if you can do that, you're just going to ace this test so badly. But a lot of people, and I don't blame you, are not doing it that way. They're going to use this sheet that I've had, okay? And the reason I provide this sheet is that you are responsible for the muscles of the human models and the cat, okay? The rest of the people, as far as I know anyway, I think they're foregoing the cat. It's really not something that they should do. In order to make a comparison, even though the muscles are not in the exact same spot on the human and the cat, well, if you can identify them, you know their actions and you can see it, I think it really helps it to sink in. Of course, we have the cat. I know we have the discussion question about this too, but we have the cat not necessarily because everybody wants it. It's other schools want it. They want a dissection component. I'm guessing they'll take a virtual dissection component. In fact, I know they will. Okay, we have agreements everywhere during this time when we're doing online, and they will take virtual dissection. But looking at models isn't any sort of dissection at all. Now, if you're talking about dissection of the cat, the doing of the dissection, you learn something. But how useful is that compared to the knowledge of what it is that you learned? Okay. Usually you'll get a group of 4 students together, and one of them will do all the dissection, and the other 3 look on, and then the 4 of them study it. Okay, so I mean, is it really doing dissection when only 1 out of the 4 is really taking the cat in hand? No, I don't think so. But what's important is knowing the information. Okay, the reason I wanted you to have this, if you could, in hand, or you can do it later if you didn't get that email, is when we were looking at human muscles and cat muscles, you could pop it out, and then you hit the link, and you saw it, and you went back and found the next one. You went back and forth, back and forth. Okay, this disappears when you go here. This is like a grand flashcard. The name's on one side, and now it's gone. I like you to see both at once. I bet a lot of you have already figured this out. If you uh, back out using the arrows, you'll end up back at the module. If you back out by hitting modules, you'll end up at the first module and have to scroll again. Okay, so I put in the human muscle and cat muscle links again. I dragged them down from week 6. Okay. But I decided, since a lot of them used the same picture, that I could put them together in a PowerPoint. And it doesn't matter if it goes 1, 2, 3 instead of 1, 3, 4, because you'll have this in front of you to look at. So I'm going to go through the muscles, and I'm going to start with the human muscle models. Takes a while to load up when it's the first time. Okay, now the PowerPoint, you can either move it ahead one at a time, or you can bust it out. But when you do that, it does allow you to zoom in on it. But when you zoom in, the picture seems to scroll off to the side. Do it the way you'd like best. Here's the first one. Okay, and I will zoom in on that one. Yeah, that's good. Okay, here's the first muscle we did. Okay. This is the trapezius, right? You still there?
Yes.
Yes.
Yep.
I never know. I've taped up my cord here so I don't knock it out. I know we've done the trapezius enough times that I hope you are not going to be fooled by it. Okay, here's the latissimus dorsi. Because I'm going to mention it again in a moment, the insertion of the latissimus dorsi is the humerus. Here's the rhomboides and the supra and infraspinatus muscle. You can say spinatus or you can say spinatus, it doesn't matter. This is a slide I would normally take out, but it was so nice I left it. Why would I take it out? Because we just did these numbers. I'm trying to cut down the number of pictures. Supraspinatus, infraspinatus, and rhomboides. Yes, we're just identifying for the most part. There'll be a few origins insertions scattered here, but that's really your homework. Here's the rectus abdominis. This with the striations of smooth muscle going up and towards the center is the internal oblique. This one going roughly straight across is the transverse abdominis. You can barely see a little bit of external oblique over here. We'll see it in another one. pectoralis major, pectoralis minor. Okay, now the arm. Gotta slow down on the arm. It's I have looked through the internet for a good model of the arm, and I haven't found it yet. If anybody else wants to give it a try, uh, be my guest. Sometimes it's a good model, but it's already labeled with different numbers or something. Okay, so put, let's see, put your left arm out in front of you with the palm up. Now I know you're pointing right at your monitor, but turn it to the left, and that's the way it goes. Your little finger is up here, and your thumb's down here. You're looking at the underside of your forearm. I'm starting with number 13 because of the forearm muscles. It runs from 13 to 21, and we're going to rotate this arm in sequence. Okay, I'm not going to start with 13. I'm going to start with 14. Watch where it goes, right down the middle. This is the palmaris longus, this muscle. This is the one where I had you put thumb and little finger together and see if you've got one. Some people have two, and some people have none at all. Some people do not have this muscle. When it functions to flex the wrist. Okay. Functions to flex the wrist. But can we flex the wrist without it? We must be able to, and we do. We can use these two on either side. Now back up to 13. This is on the flexor side of the arm. This is the flexor carpi ulnaris. Flexor carpi ulnaris. Palmaris longus. And this is the extensor. I'm sorry, I said extensor. Flexor carpi radialis. On the radial side, the thumb side. And you'll notice it looks like there's two muscles here. They're both flexor carpi radialis. All carpi muscles, there's four of them. Two flexor carpis, two extensor carpis. All carpi muscles have two heads. And none of the other muscles we're doing on the forearm have two. They have only one. So when you see two of them here, sometimes I'll take the label, put it right on top. Okay, now what I'm going to do is continue on. Line of sight is going to go 13, 14, 15. And now I'm going to turn it from top to bottom partially. There's 15, see? 15. And turning it. And we've come up with this short muscle. This one pronates the arm. This is the pronator teres. Now we're going to the other side. And 17 is the brachioradialis. Brachioradialis. If you make a fist with either hand and put your thumb up, not to the side or down, the brachioradialis is roughly right on the top of your radius bone. If you run your hand along your forearm, that's the brachioradialis. Now I'm going to move in this direction. So I'm spinning this one away. And now here are two more muscles. And you see the tape across both of them. So they are a pair. This is the extensor carpi, and it's going to the radialis. Extensor carpi radialis. It definitely fools people because they think the 17 and this one are attached. No, it's just the way it looks. It's this one and this one. Now, if you have your study guide with you while you're going through these later on, you'll be able to stop when you want to review the origins, insertions, and actions. Here's number 19. We'll probably get a better view of it. 19, this muscle comes down, splits, and goes to the digits. This is the extensor. Now we're on the extending side of the arm. This is the extensor digitorum communis. Now it's also called simply extensor communis. Okay. Goes out to all of the digits. Turning it again, here's the extensor communis. Right below it, partially hidden by the other muscles, is the extensor digitorum minimi. Minimi goes,
Charlie.
yeah.
For the practical, will we see the whole arm? Because like I'm kind of having a hard time like determining which one is going to the radialis or which one is going to the ulnaris.
I'll go over this again, but you're going to have to do it. Like I said, unless you can find me a better picture on the internet, I keep looking, and I don't find a better picture on the internet.
Okay, I'll try this first one.
No, there are some. What you really need on this one, to answer your question, you need muscles that you consider your clue muscles. You know, the ones that you always know. Okay. Now, for instance, see the skinny one in here. Now, what's that going to always be? The minimi, isn't it? Then this one you can count back to the communis, and you might get to this one, but I'll show you a better picture. On the first one, I always tell you to look for this one running right dead center. And you got to memorize that that's the palmaris longus. If you know that's the palmaris longus, okay, that's probably all I would ask on this one, because I'm not showing you, unless I point out where the thumb is. If I point out that the thumb is down here, then you should know that that's the flexor carpi radialis. Okay, so I can put in some clues in that respect. But the pronator teres, it's a dead giveaway. I mean, it's the only one that looks like that. So I understand your concern, and that's why I'm going over these again, and I'll go over them again later. You know, every time we finish, we have more time left. And those that want to stay and ask me for help with anything, or ask me to go over a portion of it, again, I got plenty of time. Okay, don't worry about it yet. Okay, this was the minimi. That's where we were. There's another one down here, the last one, number 21. And if it's not going to show here, okay. This one is the extensor carpi ulnaris. Extensor carpi ulnaris. And it's got two heads, one here, one here. Okay, if you got your mic on, will you turn it off, please? If you want to talk, that's great. All you have to do is hit the space bar and talk anytime you want. I want you to talk. Okay. This muscle. This is the triceps down here. And here's the triceps up here. You read the muscle section also in your book, and it's got pictures that match up. Okay. Number 12 is the brachialis. You'll see it better in a moment. And unlabeled up here is the biceps brachii, but it's unlabeled at that point. Okay, here's a better picture. Here's the biceps. Underneath it is the brachialis. The biceps brachii and the brachialis are synergists. They each help flex the forearm. You're looking down from the head region, down somebody's arm to their elbow. On this side, the flexor side, this is the brachialis, brachioradialis. And this one, you can learn it by the number, but it's the pronator teres. It's not a useful picture for me to make a test out of, not this one, okay, not like the other one. I try to pick the items that should not be confusing. I don't see anything, for instance, confusing about this one. This is the deltoid. And here's our supraspinatus again and infraspinatus. There are two more muscles unlabeled here, but they will be labeled in a moment. This is the teres minor. Don't need to write it down. You'll get it in a moment. This is the teres major. Now we're at the leg. This is the butt. So if this person is standing, looking to the left, and you're looking at the person's side, this is the gluteus maximus. And the gluteus medius is partially showing here, just a little, but most of it is underneath this white fascia. I wouldn't ask it in this condition, although that's the condition it really is. I'd ask the gluteus maximus. Now we're coming down the side of the leg, and here's more of that fascia. It's number 31. This is the iliotibial tract. It's also just known as the IT band. This connects all the way to the knee. There's a muscle under it, which will be labeled for you in a moment, vastus lateralis. And then on the back of the leg, this guy's turned just slightly. There's two muscles. I think in the discussion question for next week, I'll have a little fun, or hope you will too. I'm going to ask you to find pictures of bodybuilders where the muscles really stand out and submit them as a potential test question. And I will probably pick some of them to use. So good idea to read that. Okay, this number 37 is the biceps femoris. Biceps meaning two heads. Femoris referring to the fact that it's running on the femur. And the next one over is the semitendinosus. And if you've seen a bodybuilder and you've seen a picture from the back, okay, the upper leg has these two god dang big muscles. These are the two. Okay. Biceps femoris, semitendinosus. Coming down to the lower leg, the calf. Okay. We don't call it that, of course, but it helps to get it across. The muscle at the back, the large one with two heads, is the gastrocnemius. Underneath the gastrocnemius is the soleus. The soleus and the gastrocnemius work together always. They are synergists. Do you ever wake up with a cramp in your leg? Somebody's had it. I get them
Really
occasionally.
seems quite frequently. Gotta drink more water or something.
Oh, I drink plenty of water, but it's you can do a couple stretching exercises before you go to bed, but nobody ever remembers to do that, you know. But you wake up in the middle of the night, you're asleep, and you feel this tightening, and you know it's coming on. And you're lying there in the dark, and you're frightened because you know that you can't stop it. You don't know what to do. Usually, I would just roll out of bed and get on the floor because that's where I'm going to end up anyway. And then you learn that, oh, I can either raise my toes up, that's called dorsiflexion, or I can point my toes away and tighten the calf muscles, that's plantar flexion. And while you're still groggy, you know that one of them will stop this cold, but you can't remember which one. If you pick the wrong one, if you plantar flex, if you point your toes away from you, you're going to get it bad. And if you point your toes up and keep them there through a tiny little bit of pain, it'll be over with in an instant. Okay, here's the soleus, here's the gastrocnemius. There's a nice separation here between two muscles in the back and three in the front. The next one on the anterior side, because this is the front, anterior side of this separation. This is the fibularis longus. If you take your foot and evert it, okay, you turn it outward, not upward, not downward or backwards. You just turn it so that the side comes up. That's eversion. And the fibularis longus is responsible for that. Here's the fibularis longus again. The soleus. Gastrocnemius is out of the picture. Then two more muscles. This one is the extensor digitorum longus, running from up here at the knee, all the way down to all of the digits of the toes. So when you bring your toes upward, it's basically this muscle that's doing it. Extensor digitorum longus. At the very front is the tibialis anterior. If choosing either right or left, it doesn't matter. If you touch your shin, the middle of your tibia, touch your middle of your tibia, and now come half of an inch laterally and press up and down. There's a soft muscle there. That's this one. That's the tibialis anterior. Okay, so we basically here looked at the lower leg. Now we're going to look at I don't know if I like this one. See, I would have to give you a hint here. This is the lateral side. This is the hip. And this is the groin. and running from the hip all the way across the upper leg is the number 34 muscle. It actually inserts below the knee. It has lots of functions because it crosses two joints. This is the sartorius. This is the longest muscle in the body, the sartorius. Okay, I'm not gonna, before you see this again, you won't find this one. I'm gonna pull this. I see a mislabel that somebody did. '31 is the IT band again. This up here is the gluteus medius. Underneath the IT band, if you could lift it up, there's a huge muscle. That's the vastus lateralis. If you slap your thigh on the lateral side, upper thigh, just slap it, you will be slapping the IT band, but right underneath it, you'll be feeling the vastus lateralis. Okay. Gluteus maximus again, gluteus medius, IT band. Looks like I got a duplicate here. Biceps femoris, semitendinosus. Now, look where we are, 37, 38, 37, 38. Okay. And there's a muscle underneath number 38. 39 is the semimembranosus. It looks kind of squashed in there. It looks kind of small. It's huge. It runs all the way under this muscle, all the way to the other side. These three muscles here, 37, 38, and 39, on the additional sheet will identify it. You don't need to write it down. These are the hamstrings. These are the hamstrings. Here's 39 again. I've rotated, taken this, and now I'm going to rotate it. Go see it from this side. In the middle of your thigh, if you were trying to catch a basketball, somebody tossed it and you were seated and you're trying to catch the basketball between your legs, you'll bring your two thighs together, and the muscle that will come to play if you're successful is this one right here. This is the gracilis, the most medial muscle in the thigh. If you're ever standing up and you just tap both sides of your inner thigh, you're touching the gracilis on both sides. This muscle underneath it and over here and here and here, all of this muscle underneath is the adductor femoris. Adduct to bring in to the midline. So if you want to bring your leg in, or let's say you're stretched out, standing with your legs apart. Now you want to stand at attention. You'll bring your legs in using the adductor femoris. In the human, it's often called the adductor magnus. If I ask it on a test, you won't be confused because I'll say adductor femoris in parentheses, magnus. Adductor femoris, adductor magnus. This is a leg straight out in front of somebody, okay? Your leg, and the muscle right on top of it. If you're seated now, I don't know, some of you aren't, but if you are, or when you get seated, you can tap the top of your legs, top of your thigh, and the rectus femoris muscle is what you're touching. Rectus means straight on the femur, and this model has it taken out to show the vastus intermedius inside. This muscle is the vastus medialis. And you remember number 40? Of course not. I'm the only one that remembers those things. 40 is over here. This is the vastus lateralis. When you tap the side of your leg, vastus lateralis. When you tap the top of your thigh, rectus femoris. And the vastus medialis, you go down to your knee on the medial side, just above your knee. You'll find that one. You'll never see the vastus intermedius. I won't put it on a test. This is a nice, but unfortunately it was just a standalone and nothing we haven't seen already. Oh, the serratus anterior. We saw this one Tuesday. Quickly going over it then, here's the masseter. Here's the sternomastoid. Here's the sternohyoid. And this is a different view. It's nice for these, but the digastricus is in there, and in the very middle under the chin, the mylohyoideus. Okay. Now the other picture or image that had it differently, that's still available. Where? You use your muscle sheet, okay? Use your muscle sheet. These that you're seeing right now are just a series of slides. The other ones were the originals, okay? And they have everything. Okay. Here we go with the scapula. Here's the supraspinatus just peeking it through. Here's the infraspinatus. This is the teres minor. Let this one go for a moment. On the other side of this is a muscle called the subscapularis that occupies the subscapularis fossa. These four muscles, subscapularis, supraspinatus, infraspinatus, and teres minor, are the rotator cuff muscles. We have that on our additional sheet. You'll see in a second. Those are the four muscles of the rotator cuff. And then number 49 is the teres major. And it doesn't have anything to do with rotating the scapula. It goes out and inserts on the humerus and pulls the humerus back. That's the same thing the latissimus dorsi does. And you will be asked it. The teres major, name a synergist to the teres major, and the answer that you should try to put down is, or pick, is the latissimus dorsi. Could reverse it, could ask, name a muscle that's a synergist to the latissimus dorsi, and it's going to be the teres major. one tiny little muscle. Not labeled, but this was the rectus femoris, straight on the thigh. Sartorius, vastus medialis. Here's the gracilis. Obviously the groin area here. Okay, there's one little muscle right there. And that's the pectineus. Pectineus is a synergist to the adductor femoris muscles. This is adductor femoris, and it works with them to bring the leg in. Number 53 on your sheet, way down there, has psoas major. That's this muscle here. We're used to seeing muscles externally, but this is in the abdominal pelvic cavity, this huge muscle. This is the psoas major. When you're lying down and trying to lift your legs to do an exercise, that's going to come into play. If you're trying to do a sit-up, the psoas major is going to help you to do that. Okay, the psoas major right here and right here. This is attached to the femur, and it's the strongest muscle for the legs. Now, you don't have it in your packet yet. It may be in your list, but I don't think you have a picture here anyway. This is the iliacus. It's in the iliac fossa. Okay. These two join together and exit and go down to the femur. So these are synergists, iliacus and psoas major. Psoas is spelled with a P, P-S-O-A-S. On the thumb, obviously, okay, here we go. Got muscles. There's actually three. One's quite small. This is the pollicis longus. That's what we call all three of them together. The pollicis longus, politely it's called the hitchhiker's muscle because it raises your hand, raises your thumb. On the back side of your hand, in an anatomical position, this is the posterior side. Number 55 is a bracelet of cartilage that helps guide the tendons of the digits through without rubbing against each other. Unfortunately, they do rub against the bracelet itself, causing carpal tunnel syndrome in some people. The name of the bracelet, if I can call it that for the last time, this is the extensor side, retinaculatum, extensor retinaculatum. And on the other side, the palmar side, this is the either palmar or flexor retinaculatum. Either is fine. We did this one before, but if we go faster each time, we get it in. Here's the masseter. This number 61 is the zygomaticus major and minor. Just say zygomaticus. Helps in smiling. For winking around the eye, you have the orbicularis oculi. For raising the eyebrows, you have the frontalis. Your book will also call it the epicranium. I prefer frontalis. The temporalis over here, we would always ask that right now, who can wiggle their ears? And there'd always be somebody, and it was always so much fun. But that's something you lose on online unless we see somebody's face. Okay, this is the temporalis. 57 around the mouth is the orbicularis oris. 62, okay, is actually underneath the masseter, which has been taken away here. 62 is the buccinator, and it aids in chewing, whistling, and if you try to blow something cold like soup, it'll come into play there too, the buccinator. 63 is the levator, levator superioris labii. What a name. It's the hardest one on the thing as far as remembering the name. And what it does, it picks up the sides of your nose or in part the side of your mouth and gives you that sneering look. Okay, I've only got 3 more to show you. I'm going to get it done. You wanted it. Okay, we're going to learn the muscles of the eye. And these are on the sheet. Okay, however, I know you weren't prepared for them right now. So this is the first time. There's a muscle that goes to the top of the eye. It's 64. You can't read it very well. I can't either. There's a muscle on the medial side of the eye. There'll be one on the lateral side and one underneath. The one at the top of the eye is the superior rectus. Superior straight rectus. It will go from here, 64, and it's missing here, but we'll take it out and we'll attach back here. Okay, when 64 contracts, what happens to the eye?
Goes up or looks
Yep,
up.
that's it. You look up or elevates the eye. Okay. There's a muscle on the side, 66. Okay, when it is attached, here's the attachment, it will attach back here. If that's the only muscle that contracts, what's the eye going to do?
Look to the right.
Look laterally. In this case, you're right. It'll look to the right, but looking laterally is what will be safer. Here's one at the bottom, number 65. This is the inferior rectus. And the inferior rectus is going, when it's pulled, it's going to cause the eye to look down or to depress the eye. And then 67 over here is the medial rectus, and it causes the eye to turn in or to turn medially. Nothing could be easier than those 4. Unfortunately, sort of messes it up here with 2 last ones. This number 69 is the superior oblique. It runs here behind the eye, and then in sort of a sheath like pulley, it turns to here. Okay, when it is contracted, okay, the superior rectus causes the eye to abduct. That means look outward. But you can see it's pulling this way. And so the eye is going to abduct. And it also causes the eye to turn downward, because it's going to pull this way, and this is going to go. It's hard for people to understand that, but these 2 oblique muscles that I'm going to show you, we're already on to one. They both abduct the eye. Okay. These are the muscles that are necessary for us to hone in as fast as possible right on some spot that's not north, south, east, or west. Now, the inferior rectus is not a good picture of it. It's running under here. It's running under here. It does have a label, but here's the inferior rectus, and then the inferior rectus attaches right here. Comes across and attaches here. The inferior rectus abducts the eye, but also causes it to look up. So the superior, I said rectus, I meant oblique. The superior oblique causes the eye to look down and out. The inferior oblique causes the eye to look up and out. They both cause the outward or abduction. And just a quick reminder of these two. In between the ribs, this is the external, here's the external intercostals. These are for breathing in or inhalation. And the internal intercostals are for breathing out. They usually are not functioning. They just let gravity breathe out for us. But when we're walking faster, running, or doing anything energetic, we've got to breathe faster, so we got to make room quicker. And so forced exhalation is the main function. Okay, first thing I want to go over is the additional terms that we were talking about when we got cut off on Tuesday. But, you know, if we ever do get cut off, give it 10 minutes for me to run and get another computer if I have to. I think everything that could go wrong has by now. And we'll be back on. If not, you'll get an email and I'll tell you what's going to happen. But hopefully that doesn't occur. Okay, additional terms. This one, you can just look on right now, or if you have it as a hard copy, you can go to it. On the arm, we just saw extensor pollicis longus. We saw extensor retinaculatum, and we saw the flexor retinaculatum. They may actually be on your study guide now, but they weren't always. So I always included them as additional terms. But you are responsible for identifying these, not telling me what they do, or origins, insertions, or actions, just to identify those. On the head, we looked at these just a moment ago. You can read the list as well as I can. The rhizorius, I didn't go over, and
Hey,
yeah,
I can't see.
you can't see?
I can't see what like the terms or anything, or do you just want us to look?
First off, look up at the logo. I got a hand spinning up there. Can you see that?
Are you saying like you're sharing your screen right now?
Oh, I sure thought I was. I guess not. Okay, so
No.
Hang in there. Okay, am I sharing it now?
Yep.
Yep. uh, you know, 47 years of doing it the old way, and 4 months of doing it the new way. I'll cut myself a little slack. Sorry about that. Okay, I appreciate it when you just go right ahead and interrupt if anything like that happens again. Now you can see the terms, please.
Yes,
Yes,
sir.
we can.
Yep.
Okay, okay. For the arm, here are the three things we looked at. You're required to be able to identify them. That's all. The head, okay, to identify, uh, and you do have to know. I don't even see masseter in here. It doesn't matter. It's number 22 anyway. I will not cover. I'll cover it, but I won't put it on the test. So if you're studying this weekend, don't worry about rhizorius. Okay, that's that one. I won't include. The eye, here were the four rectus muscles and the two inferior oblique muscles. For those, you don't have to know insertions. You don't have to know origins, but you do have to know actions. You'll find the actions given to, on the sheets for the human. Okay. Some other terms. The linea alba, that's the white line down the center of the anterior of the body, okay, separating the abdominal muscles from each other, right and left. Lumbodorsal fascia, we haven't gone over that yet. So you're going to run into a couple that you say, hey, I don't think he did that yet. He's going to, or you just ask him to, okay? But the lumbodorsal fascia is in your middle back, the middle diamond-shaped area in the middle of your back. Now, the word antagonist is quite important. 2 or 3 questions at least worth on the exam. Antagonist, when two muscles work against each other, one does one thing, the other does the opposite. Synergist is when 2 or more muscles work together to perform an action. The diaphragm that we talked about, okay, you have to remember that's the prime mover of respiration. And you're going to ask me why, but I'll tell you. Innervated by the phrenic nerve. Phrenic nerve. The fact that the diaphragm is innervated or acted upon by the phrenic nerve, that belongs in physiology. That doesn't, to me, belong in gross anatomy. Okay, but the physiologists got a hold of this test and they put it together once, and they snuck that uh, question in, and it has stuck ever since. So I'm telling you right now, it's going to be on the test. So what could make it any easier than that? Okay, you'll obviously know the phrenic nerve by its spelling. You may not be able to recognize it any other way until you get to physiology. Okay. The external and internal intercostals we just did. The iliacus I showed you. Okay. Now I've got all weekend too. I mean, I'm hoping you'll take a good chunk of it and start studying. And I've got time too to spruce things up the way I feel they should be. And the iliopsoas, we didn't cover that at all yet. It's actually where the iliacus muscle and the psoas major come together and exit. Okay, and that's there. It's called the iliopsoas. You can put that in parentheses if you're able to write right now. Put it in parentheses, and that means it's off limits unless I unlock it and then have you erase the parentheses later. Okay. If I ever ask you a question that I told you I wouldn't, you bring it to my attention and everybody gets credit for it. Okay. Rotator cuff muscles, you need to be able to identify what they are. The supra, infra, and subscapularis, and the teres minor. Those are the rotator cuff muscles. Okay. Each one of these has origin, insertion, and function in the study guide. Okay, so you have to do whatever we have in the study guide. The quadriceps. The quadriceps are your upper leg muscles. On top of your thigh, rectus femoris. On the side, the vastus lateralis. On the medial side, where you catch the ball, the vastus medialis. The vastus intermedius could only be found if you were able to lift your your rectus femoris muscle straight up, and you'd find the vastus intermedius underneath it. The hamstrings are the biceps femoris, semitendinosus, those two muscles on the back of the bodybuilder's leg, and the semimembranosus. Three muscles make up the hamstrings. A typical question, and it's an easy one, but there are easy questions mixed in with the rest of the test. Like for instance, the rectus femoris. What group of muscles does this belong to? And your answer, if you were writing, that you're not going to be, of course, but if you're writing, the answer would have been quadriceps. Well, it'll be multiple choice. It'll be quadriceps, rotator cuff, hamstring, something like that. And you would want to identify it as a quadriceps. Okay, I'm going to go to the cat muscles, and that's right here. Some of these you've seen before. That's great. We don't have to spend forever today on those. Here's what's going to happen next week on Thursday. I'm going to give you the opportunity to take a quiz in class, okay, to take a quiz for extra credit. If you don't get any of the points, you don't lose anything. If you get some of the points, you gain 5 or 10 extra credit. Normally, I do this with my face-to-face class after their first lecture exam. I let them see their exam, they mark their questions, and they have to write out the correct answer for me, put it in a stapled piece of paper, whatever, and give it back to me. And then I go over it with them. So I know that they know where the correct answer was to be found. I don't need to do that with you anyway, because your class average was higher than theirs was, has been so far. I think we're doing well so far. But we won't be doing well if you don't study this weekend, and I want to give you the encouragement. Okay, and here's the encouragement. I'm going to give a bonus quiz, and I'm going to, you'll take it on the internet, and it's going to be lightning fast. You will not have much time. Anybody trying to look up the answers rather than know them, well, you'll get a couple of points. But if you want the maximum number of points, you got to know some stuff. And that is, here's a picture. Question number 1. Here's a picture. and it's maybe got a star. Make it an easy one on the pectoralis major. You've seen that picture before, okay? Or I could use a cat, okay? And I will have underneath it, I haven't decided yet. I just dreamed this up about 5 minutes ago. I'm going to either have the name, origin, insertion, and action. And I'm going to have 4 or 5 name, origin, insertion, and action. I don't think I'll do the name because it'll always be the same. So there's the muscle. You name it, you think about it, and then you pick the correct combination of origin, insertion, and action that I have. And I will have 3 things, origin, insertion, and action for choice 1, another 3 for choice 2, and another 3, and all of some of the choices within the 3, if you understand, origin, insertion, and action. One of them might be right, but the other 2 could be wrong. That makes the question wrong. So what I'm asking you to do is look at the muscle and know which printed combination of origin, insertion, and action it goes with. Mark it just like you did on a regular test, okay? The test is going to be set up so that you do one at a time. You can't go back. So once you've made your answer or your choice, moves right along to the next question. That keeps it going and flowing as much as possible, okay? And I'll make the maximum number of points 10. I'm going to have it go fast enough that nobody can finish it, but I'm going to have it go slow enough that the people who know it can amass up to 10 points. Okay, comments?
Charlie, you said that this was going to be in class, or is this going to be online?
It's going to be online. It has to be online. So I'll decide how to do that. Okay, let me have the weekend and Tuesday to figure that part of it out. It may be your ticket into the class. Okay, you do it first, but there's going to be very limited amount of time for extra credit. You know, so that'll be my problem. I don't have an answer for you right now. But do you understand what you have to do?
Yes, thank you.
My whole intention here is to get you to know the material before the actual examination comes along. Okay. My intention is not to throw away extra credit, but you don't get as much extra credit opportunity as a face-to-face class. So I'm putting this together. Okay, here we go. This is all trapezius. Trapezius, trapezius, trapezius. You don't need to say anything else. You don't have to identify the type of trapezius. Okay, we did the latissimus dorsi. And you stop me if you think we need to stop on something. Number 4 is the rhomboides. Nice looking, is that? 2 is latissimus dorsi again. Here's a really nice picture of serratus anterior. Also infraspinatus right there. 7 are the 3 parts of the deltoid in the cat. 12, right in front of the triceps, is always the brachialis. Where's the biceps brachii and the cat is on the other side. That's one major difference. Here's the pectoralis major. And this larger one is the pectoralis minor. Here on the upper half of the arm, on the inner side, this is the biceps brachii. The supraspinatus and infraspinatus, and one of the triceps. One head here, one head here, third head have to be dug out in between. We won't worry about that one. Triceps again. Right in front of the triceps is the brachialis. And right in front of that is one part of the deltoid. Deltoid would be the answer. On the underside of the arm, this sort of mirrors what we did with the human model. This flat one, you can't really, you can see it's where it's headed. I wish that 13 weren't placed right where it is. This is the palmaris longus. It's a broad, flat muscle. Okay, where's the thumb? The thumb is up here. This is the thumb side. So this must be the flexor carpi radialis. And this is 13, and this is the flexor carpi ulnaris. "14," if you're good at memorizing numbers, would be the palmaris longus. And then 15 is the flexor carpi radialis. And 16 is that partial muscle, goes about halfway across, the pronator teres. When we get all the way around, 17 can be lifted pretty freely. The small, thin muscle breaks quite frequently. That's the brachioradialis. It's whatever the pin goes through first. So we don't want this, we want this. This is the brachioradialis. Underneath that is the extensor carpi radialis. And then below that is the extensor digitorum communis, or the extensor digitorum. Number 19 is the extensor digitorum again. Here was the brachioradialis. Here, barely visible, was the extensor carpi radialis. 20 is the minimi, and 21 is the extensor carpi ulnaris. Now you have to know where the thumb is to be sure that you're on the right side. But if this were you lying there, your thumb's going to be on that side. That's always the lateral side. It's always the radial side. The radius is over there. The masseter. Okay, these muscles that we did the other day, the digastricus to open the mouth here and partly showing here. 25 is this one, and that is the sternohyoideus. It's hard to follow 23, but there's where it's going. That's the mylohyoideus. And then the sternomastoideus. Okay. Way up here is number 2. That was the latissimus dorsi. Okay. Underneath it, the serratus anterior is even peeking through. So this one is not, sometimes confusing, muscle that people call the latissimus dorsi. No, that's it up there. This is the external oblique. The external oblique in this one has been rolled back. And this is the internal oblique. Transverse abdominis. And 30, not a great pinning. It can't be anything else though. The rectus abdominis. Number 31 matches number 31 on the models. You realize that, of course. This was the IT band. And underneath the IT band, when we lift it up, is that large muscle on the side, the vastus lateralis. Going around, this is the biceps femoris. I think what you're expecting as we go around further is the semitendinosus. Well, no, we'll get there. We're going up here first. This is a really actually good dissection of the gluteus medius and the gluteus maximus. This is the caudofemoralis. This is a muscle that you and I don't have, and since it's not a human equivalent, we don't cover it, okay? Except to let you know what it is. These are the two you want. On the inner thigh, you have two broad muscles. This one's been cut. This is the sartorius. And this one over here, not cut yet, is the gracilis. Gracilis sartorius. This is sartorius bisected. And here's the gracilis, and it's been cut as well to show the muscles underneath. And this area here, which is roughly triangular, that's the adductor femoris or adductor magnus. Now, the adductor femoris doesn't refer to a cat femoris. It seems like it might. It refers to the femur. Okay. Adductor magnus is the term that is usually used for humans. So I'm going to just tell you right now, since I have to put a multiple choice question to this, if I use it, I will always have the answer be adductor magnus, always the human form. Okay. Now, I don't think I have a slide that shows it yet, but see this little teeny muscle right up here? That's the pectineus again. And we have another big muscle down here. It's going to show in the next picture, I'm sure. Semimembranosus. Okay, here we're back at that biceps femoris. Coming around the back, here's the semitendinosus. Again, the sartorius is moved aside, and the gracilis 35 has been moved aside to show this number 39. This is 39. This is the semimembranosus. Now, see if you got your orientation correct. Here's the leg. Here's the groin. The other leg's coming down here. Okay. Here's the gracilis pulled down. Okay. Here's the sartorius pulled down. And down here underneath that is the semimembranosus. This area here, which is roughly triangular in shape, is the adductor magnus. Okay. This was the semimembranosus here. Here's the roughly triangular area, the adductor magnus. Here's the tiny little pectineus. Now on the other side was hidden by the sartorius, number 34. It's been cut. It's been cut. And we pull it back. And there's a muscle underneath there. That's the vastus medialis. Pull that aside. And there's a large cord-like muscle. You can see it's been cut here. It's rounded. It's almost like textbook perfect muscle. This is the rectus femoris. Here's the rectus femoris again. It's the same muscle. Here's the cut. This was the vastus medialis. And there was an attempt here to show muscle 42, the vastus intermedius, but I think it's a failed attempt. And I told you I'm not going to ask you that one. Okay. Looks a little bit better. It's the same picture, I think. One of my first objectives in putting this together last night was to get rid of duplicate pictures and tame this down. So this is just a duplicate, sorry. I can get rid of it in no time. Okay, looking at the back of the cat, these are the calf muscles. And we don't call them that, we call them gastrocnemius, number 44, gastrocnemius. Possibly out of order, 45 right here is the tibialis anterior. Okay, here's the shin, if I can call it that, if you let me. And I told you to touch to the lateral side of the shin just a little bit and press, and you'll find a rather soft feeling muscle, the tibialis anterior. This muscle here, which goes straight up and down, and then curves into the feet and toes. This is the extensor digitorum longus. That's for the toes. It's a pretty nice picture. This is the gastrocnemius. It's not labeled here. It would be number 44. Okay. This is showing the middle three, 46, 7, and 8. This is the soleus underneath the gastrocnemius. This is the fibularis longus to evert the foot. And then the next muscle right here, that's the extensor digitorum longus that we just looked at. The tibialis anterior is down here, and the gastrocnemius is there. But the idea of taking this picture was to show the three in the middle. Okay, that shows all of the muscles on the cat. Any questions?
None on my end. Looks a little different on the cat than a human. Commentary.
Oh, the muscles?
Yeah.
Yeah, they are. We had to, one semester about a year and a half ago, we couldn't get any cats. Nobody could get cats. And we had to use mink. We had to dissect minks. And you talk about differences. Oh my God. Yeah, it's different. That's why they call some of these courses comparative anatomy. That's one of the reasons they want you to actually have a dissection experience. They know you're not all going to have a cadaver. we always do put some cadaver questions on the test. So I'm going to, in order to do that, I have to show you the cadaver. And, but I actually feel that because maybe it's because I've had so many years at it, I feel that the cat is clearer than some of the human models. But that's just the way it is. So I don't have anything I can say that might make you feel more at ease. It will hit home. You will get it.
Charlie, would you say this is one of the more difficult sections of anatomy?
The students at Saddleback say it is. Okay. I don't care. If you're going to rate my professor and look up any professor of anatomy, the students will always say that the second test is always the hardest. Once you get past that, you're home free. You know, I'm not going to say that myself. It's whether or not you like dissection, or in this case, to observe dissection. It's whether or not you get committed to learning it. Not everything is going to be to everybody's liking, but the grades that I have gotten, usually I get into the 90s, as you know, on the first practicum. On the second practicum, I'll normally get between 88 and 92. Okay, as a class average, but not always. In the past, I've had it so that it was always in the C range on the practicum, and I just said to myself, I'm not tolerating that. Not tolerating it. I'm going to be sure they have every opportunity, every picture, up, down, sideways, whatever, to learn this. Okay, so I think you can do it.
Thank you,
And,
Charlie. Thank you.
well, I want you to do it anyway. Uh, I pushed it back one more day so that there's more time to study. But now I've given you a further incentive to study. And I'm not blowing my own horn here. I'm just telling you the truth. I gave you an incentive to study this weekend. Okay. Of course, we all have to gear our time to whatever's going on in our lives here these days. Sometimes it's nothing. Okay.
And Charlie, did you say that the bonus quiz was next Tuesday?
Nope, I said it was going to be Thursday.
Oh, awesome.
It will be Thursday because I'll tell you the truth. I don't think I'll have time to put it together adequately the way I want by Tuesday. So I want to give myself to Thursday. And you too, the same thing. Some people, like I said, they take anatomy, they don't even like the course at all. It's just a requirement that they have to take. And I don't know, some people take anatomy when they don't need to take the course. And I wonder why they do it sometimes. And others just are straight out interested. I had a janitor once. Did I ever tell you about Mr. Craig?
No. No.
I don't think so.
Okay, I will, and then I'll just open it for questions and sign off. But whatever. Mr. Craig is the janitor at UCI, and I, as a graduate student, I'd be in the lab at 3 and 4 in the morning because I didn't want any people around. I want to work or do whatever I'm going to do, And but there was always one person that came around. The elevator at 3 in the morning in Steinhaus Hall would open up, and out would come a cart, and here would be Mr. Craig. Mr. Craig wore a baseball cap backwards. I think he invented doing that. Making yourself look 40 points of IQ, lost as soon as he turned it around. But he was a big guy. This, I mean, he always smoked a cigar, and he'd bring his dust mop and stuff and clean up the hallways and clean up the classrooms. And he must have weighed 350 to 400 pounds. And well, he was a very talkative guy, though. He'd come into my lab because I was the only one in the building, it seemed. He'd come in and we'd talk about this or that. And I didn't have to use any fancy words because his education had only gone to the second grade. And he says to me, "What's in that shiny metal box in the room next door?" And I said, "Oh, that's a cadaver. That's a cadaver." And so he goes out and he's mopping or sweeping, but he comes right back in. Comes right back into the lab. He said, "What's a daver?" And I said, "No, not daver. It's a cadaver. It's a corpse. It's a dead person." He said, "Oh no, there's a dead person in there. I know. I can sense a dead person. You know, I can sense these things all the time." I said, "No, there's a dead person in that box." He said, "Let me see. Let me see." He had this curiosity about him and disbelief too that he hadn't known he had been sweeping up around this cadaver box. So I went to the other room with him and I opened it up. It's a swing away lid. You have to really put some effort into it. And there was the cadaver with sheets on, you know. He almost dropped the cigar out of his mouth. It would have been instant cremation had it hit the cadaver. Oh, God, we got rid of that. And I said, "Okay, let's close it back up." He said, "No, no. He wanted to look. He wanted to look." And I said, "You really want to look? You know, you're really interested." "Oh, yeah. Oh, yeah. Yeah. Okay." So I undid the cadaver. Happened to be a female cadaver, fairly young age, 30. Unusual, very unusual to have a cadaver that old, or that young. And I said, "You want to see the heart and lungs? That's got a convertible chest." And lifted it up before he answered. And, oh, he was amazed, you know. And then I put that back together. And then he goes, "Well, what's this? What's all this stuff?" I said, "Those are intestines." And he said, "Yeah, those intestines? Like make sausage?" You know, I said, "Well, that's some other animal, you know." I said, "But those are intestines. It's about 26 feet." He said, "No way, there's no 26 feet. No, no, no." I said, "Yeah, here, you hold this end, and I'll hold this end, and we'll back up, and I'll show you there's 26 feet. Guess, you know which end I gave him." So, no, he wouldn't do it. He couldn't anyway. The mesentery would have stopped us from pulling it apart, but he didn't know that. He's just out of his mind with disbelief and belief at the same time. So anyway, we finished up, closed up the box, and he went his way and cleaned up the rest of the building, I guess. I went my way for the evening. Now I didn't know this was going to happen, but the very next day they took the cadaver and they moved her to another building and brought the box back. It wasn't perfectly clean either. I'll tell you how I know. But they brought the box back and put it in the same place because the vendor wanted to pick it up. Well, that night, around 3:30, here comes the sound, here comes the mop, here comes the click mop, and here comes the shuffling along, big old Mr. Craig. And he's going the other way for a while. I got on the phone. I knew there was another graduate student still in the building. He was a friend of mine. His name Robin Gorham, and he didn't like to be called Robin, so he wanted everybody to call him the Lizard King. He was crazy. I said, "Robin," and then he said, "Nope, won't talk to you." "Okay, Liz." I want you to come and come down to the lab. He said, well, I'm going home. No, just come down to the lab. I won't be a minute with you. Okay. So here he comes, and he's got long hair. He's got the biggest piece medallion on, and it's swinging every which way. And I said, come on into the lab. And he said, well, why? It's empty. There's nothing in there anymore. They took her away today. I said, I know. So I'm not going to go down to the basement, which I did usually. I'm not going to go down and sleep in the basement of the building. I'm going to sleep in the cadaver box. And so I asked him to hold it open and let me get up on the tray and my head on that little block. And I said, okay, now turn the lights off when you go. And he said, okay. It was like it was the most routine thing to do in the world. He didn't question it whatsoever that I was going to sleep in a cadaver box. Well, you know, that's not what I was going to do. I've been waiting for Mr. Craig to show up, and I was going to come alive again. He came into the room through the far door, and he wouldn't come near the cadaver box. I could hear him through it. But when he finally got there, he did it real fast. He come over real fast to get it done with, you know, because he's all by himself now, and there's a dead person in there. When he got right next to it, I put my hand under the lid, lifted it, and go, Craig, Craig. That was it. That was it. I heard the door burst open. The mop handle hit the floor, and 300 to 400 pounds of earthquake as he ran down the stairway, the hallway. I had my fun. Anyway, he got his education too. He quit 2 days later. Now don't worry, I found him later at Monteverde Elementary School, and I talked to him on one evening. I don't remember why I was there, but he said, it's much better here. It's much better here. No, none of those shiny boxes and stuff. Okay.
Dude, that's pretty funny.
Well, you had to be there. Okay. Now, it's just me and you. If you have any questions, if you want to leave, that's up to you too. You've had plenty of time, and okay.
Thank you, Charlie.
Thank
Okay.
you.
Thanks.
Thank you.
Thank you.
Hey, Charlie.
Bye-bye.
Thank you.
Thank
It
you.
takes only the first
Thank you.
person. Takes the first person to say goodbye.
Thank you, Charlie. Have a good rest of your evening.
Okay, Tyler.
Bye, Charlie. Thank you.
Bye, Natalia.
Bye, Charlie. Thank you.
Bye, Emilio.
Hey, Charlie, I had a few questions.
Yeah.
So the IT band, is that the same thing as the tensor fascia latte?
Exactly.
Okay. And then my next question was the extensor reticulatum. Is that like it goes around the hand like
Yep.
like a band?
Yes.
Okay, cool. That's it.
Well, those were easy.
That's fine. Well, that's it for me. Thanks, Charlie. Have a good one.
Okay, Ryan.
Bye, Charlie. Thank you.
Bye-bye, Gabby.